Thank you so much, Dr. Torek, for that excellent presentation on family-centered care. It's my pleasure to welcome our next speaker, a special guest and invited faculty, Dr. Josephine Grima. Dr. Grima is a PhD by training and serves as the Chief Science Officer for the Marfan Foundation, where she is responsible for the development and coordination of the Foundation's research program, and she also leads the Help and Resource Center to distribute educational material for lay and medical audiences. So we are delighted to have Dr. Grima with us today to speak on how to raise awareness of aortic disease. Dr. Grima?
Okay, thank you very much for including the Marfan Foundation here at this very important symposium. I'd like to really thank the Heart and Vascular Institute, and I'm really excited to participate. So the Marfan Foundation was established in 1981 for more than 40 years ago, with a three-pronged focus on education, support, and research. Our mission is to save lives and improve the quality of life of individuals with genetic aortic and vascular conditions, including Marfan, Loeys-Dietz, and vascular Ehlers-Danlos syndromes. We work tirelessly to advance research, serve as a resource for families and healthcare providers, and also raise public awareness. You know, our vision is a world in which everyone with the genetic aortic conditions can live their best lives. Over the past few years, the Marfan Foundation expanded, adding a vision for VEDS, or the VEDS movement, bringing in the Loeys-Dietz Syndrome Foundation to serve people with LDS. Also, as part of the foundation is the GenTAC Alliance, and this is a global community of scientists, physicians, and healthcare professionals, all focused on advancing the care and research for all forms of these types of conditions. The Marfan Foundation just held our International Research and Clinical Management meeting in August of this year. We run this meeting almost every 4 years. This year, it combined a 2-day international symposium on Marfan and Loeys-Dietz and other related conditions, with an additional day specifically on vascular Ehlers-Danlos, and that was really a first time for that rare disease to have so many people in one room. And then we had a day for the 7th GenTAC Aortic Summit, as well as a separate international patient symposium. We had over 270 in-person registrants from 21 different countries, making it the most well-attended professional meeting in our history, and certainly a first for the vascular Ehlers-Danlos group. We've also expanded internationally with virtual events from the foundation, different materials, and now our website is in multiple languages. The foundation focused on public awareness and medical education on aortic disease and risk factors since the mid-1990s, when Jonathan Larson, the playwright of Rent, passed away from an aortic dissection suddenly, which was believed to be caused by Marfan syndrome. Between that tragedy and the recent death of Grant Wall, the sports journalist at the World Cup, the foundation has conducted several extensive campaigns so that the general public knows the risk factors for aortic dissection, so that the patients who are at risk know the signs and are prepared for an emergency, and so that medical professionals who don't see many patients with these relatively uncommon conditions know when they should suspect an aortic dissection and the appropriate imaging and treatment that they should pursue. Most recently, we've been educating our patient community about the latest aortic diagnosis and treatment guidelines published in November by the AHA and ACC. One of the key points from these new guidelines is that people with connective tissue conditions and should be seen by experienced surgeons and physicians. We encourage institutions with this type of expertise to conduct educational outreach to the community so that the community of affected people know where to go for such expertise, and to get to know the doctors before an emergency or even just to have prophylactic surgery. As you can see here, we have many opportunities to partner with the foundation for educational and different types of community events. This is a great way for you to showcase your expertise and that of your colleagues, and have a great way to connect with the community. We work with hospitals nationwide and even around the world on educational outreach. Such programs arm patients with the information that can save their lives and introduce them to the local experts. Also, patients meet each other and together with medical experts form a community of support. This is really priceless for people with a lifelong genetic condition and that are progressive and and often affect many family members. Of note is our in-person patient conference, and this is a picture from one of our latest conference in California. And this patient conference can attract up to 600 people. Sometimes we also have about 100 different physicians there as well. The conference provides a full array of activities, including medical presentations and Q&A medical workshops with the experts, mental health workshops, teen and kids program. That's a really great program. They love meeting other children that are in the same situation as they are, and they continually have very long relationships. There's offerings on, now that we have many different divisions, we have offerings on Marfan, LDS, and VEDS, and plenty of opportunities for networking and socializing. At this conference, we hold a health fair with our hospital partner who provides free evaluations for people that have either difficulty in getting a diagnosis or have never had the opportunity to meet with some of the experts, or maybe they don't have health insurance. So our hospital partners provide free echocardiograms and eye exams, and our professional advisory board provide their expertise and time to review medical records. It's a great way for physicians to observe and work with the experts in an all-day clinic with people specifically with these conditions. Sometimes we can have up to 100 people having appointments, and over 300 appointments because they can see people with different in different disciplines. A clinical wrap-up section is also offered at the end of the day, where we discuss all of the difficult cases and management issues. And this is one of those programs that together we can truly empower and support patients in a way that helps them to improve their outcomes. The foundation has also powered Aortic Disease Awareness Week since 2019. And this is a worldwide initiative for medical education, public awareness, and patient education. We work with hospitals around the world in order to promote their events. Aortic Disease Awareness Week is in September. And if you really like to get involved with this, you can contact my colleague, Eileen Michelli, our Chief Program Officer. So in a talk about aortic disease awareness, you might wonder why we are including our walk program. And it's really not about walking for us. It's not meeting that, doing a 5K or walking from point A to point B or achieving our personal best. Really, the event is meant to bring together community. And we try to bring together the patient community and the physician community in a more informal way. The walks are more like a family festival, and we joke that the walk is optional, but really that's the truth. The true value in this community is coming together and affected families meeting each other and local experts who are there for them. And it's truly priceless. For the rest of our year, which goes through June, these are the walks that are scheduled. We do hope that we come to Pittsburgh in our next fiscal year. And if you're logged on to today's talk and you're from any one of these cities, we invite you to join us. You can go to the URL to register. And if you want to talk about partnering for a higher profile, you can call my colleague, Kim Huddleston, and her email is on the screen. I also want to take a moment to talk about our Help and Resource Center, and our nurse, who is the director, is Jan Lynch. She answers all the questions on Marfan, Loeys, Dietz, and VEDS. She incorporates our professional advisory board into these discussions if she needs to. She uses our knowledge base, and she uses one of our most popular resources, which is our institutional directory, which has a list of places with extensive research on Marfan, Loeys, Dietz, and VEDS. While that list is limited, she also keeps a list of individual specialists, people who have seen patients with connective tissue and have had experience with Marfan, Loeys, Dietz, and VEDS, even if they're not at an institution. So in addition to Jan, we have 22 other staff, some of them who work in our office in Port Washington in New York, and others that work virtually around the whole country. We even have one that has just moved to Canada. So I've listed some of the members here, and we're all on the website if you want to get in touch with any one of us. So finally, I just want you to know that we have some upcoming events. We have our second Spanish Summit, which is online on January 21st. And we have many different educational events, regional symposiums at different hospital systems. We have our Heartworks galas. These are priceless events that we bring together everyone to celebrate many different physicians and patients that have made differences in the community. And there is the listing for our conference this year that will be in Chicago at Northwestern Medicine and Lurie Children's Hospital in Chicago. So with that, if you're interested, we'd love to get to know you more, and so please get in touch. So thank you.